important you have been to the graduates, to our school, and to the profession of podiatry. Thank you for accepting your graduates' invitation to join us today. Your presence is a demonstration of the esteem in which our students hold you. To our faculty, each year I convey the same message of thanks to you. You hold and continue to convey the medical and surgical knowledge that prepares these candidates for the degree of Doctor of Podiatric Medicine, which they will receive today. Your time, your dedication, and your skill has created this class. You have worked with each of these men and women for 4 years. Today, you, most of all, our faculty, can take pride in this new class of graduates. Finally, to our graduates, thank you. This is your day. Thank you for the last 4 years of your inquiry. Thank you for the last 4 years of your industry. And thank you for the last 4 years of your intelligence. Speaking to each graduating class for the last time as your dean is a rewarding duty of mine. It gives me the opportunity to look at your class as a unit and try to articulate your role in our school's history and in our school's future. 4 years ago, your class of 40 men, 47 women, came to us with diplomas from 66 colleges. You came from 27 states and 9 countries. You have spent 4 years with us accumulating the knowledge that will carry you through the rest of your lives in a profession that has existed for over 2 centuries and which is now entering an entirely new era. There is a saying that everything old is new again. Charles Dickens began A Tale of Two Cities with a description of the times in the late 1700s in France and England when he said, "It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was an epoch of belief, and it was an epoch of incredulity." We had everything before us, we had nothing before us. We were all going directly to heaven, we were all going the other way. Charles Dickens wrote those words in 1859. While the description is applicable to the geopolitical world that we all witness today, it is even more applicable to the healthcare industry. Today we have over 300 million people living in the United States. 40 million of those people get their health care through Medicare and Medicaid. 220 million people possess insurance coverage, and 40 million people of our citizens are uninsured. Today we are told that health care is an entitlement, and as such should be available to all. However, we are also told that our current medical system will be bankrupt shortly. So today we have conflicting calls for universal coverage and for privatizing Medicare. We sponsor an explosion of new medical technologies at the same time that we demand cuts in the amount that we spend on Medicare and medicine. We turn the practice of medicine into a for-profit business at the same time that we demand higher patient satisfaction and error-free outcomes. This is the tale of 2 healthcare cities into which we welcome you this morning. The question that each of us in the profession of podiatry must ask is, where will I fit in the changing system that is now our healthcare system? For you as a doctor of podiatric medicine, it is the best of times and it is the worst of times. It is the best of times because you have received the finest medical education that is available in this country and thereby, through extension, the world. You will enter into residencies which will train you to treat medically and surgically every conceivable condition that presents itself in the foot and ankle. You will enter into practice at a time that the baby boom generation enters into old age and virtually ensures you an unlimited number of patients that will demand your services and your skills. Correlatively, it is the worst of times for anyone to enter into a medical profession. Not because you will not be able to engage in practice, you will. Not because you will not be able to make a living, because you will. Rather, it is the worst of times because the simple practice of medicine in the coming decades will no longer exist. The days of opening a practice and going it alone will soon disappear. Your practice of medicine will not resemble mine, nor the practice of anyone who taught you here over the last 4 years. Your practice will involve accountable care organizations, electronic health records, patient satisfaction, meaningful use, time management, team practice, and a level of data collection and organization that is unprecedented in medical history. I wish that we could have prepared you for this transition. However, no one in the next 2 years will be able to prepare you for this. The legislation that established these parameters that we will all have to meet was just passed, and the regulations that will describe the requirements have not even been drafted yet. We do not know is that podiatry, the profession that you enter today, will be the core service and the structure of any healthcare delivery system that finally emerges from this paper storm that is being created by our legislators. We also know is that the saying that I quoted above is true. Everything old is new again. Accountable care organizations are the specter that you will face. Health maintenance organizations were the specter that we faced 3 decades ago. Electronic health records are the hurdle that you have to clear. Hospital privileges and malpractice crises were the hurdles that we had to clear. The reason that a novel such as A Tale of Two Cities is called a classic is that it contains truths that are ageless. Those truths written in 1859 apply to you today. For every graduating class that a school has produced, it has been the best of times and the worst of times. You enter into a difficult medical environment, but the medical environment has never been easy for us in podiatric physician. We, as a profession, have thrived in the healthcare system because we supply and perform medical services that our patients so desperately demand. That intimate and individual connection with our patients will not be replaced by any electronic medicine. The future structures of healthcare delivery, such as accountable care organizations, independent practice associations, and regional healthcare councils, will all center on patient satisfaction. Your medical practice delivers that patient satisfaction, and you will be a necessary component of their medical delivery. In reality, any professional life is a challenge. Today you are entering a medical environment that will challenge you every day of your career. Today your status as students end, and your life as a doctor of podiatric medicine begins. Today you become the master of your own destiny and begin to dictate the terms of your own future. Is this challenging? I hope that it is, because without that challenge, you will never reach the heights of which our faculty has prepared you. Martin Luther King Jr. once said, "The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands in times of challenge and controversy." The decision that you must make today is to face each challenge that comes at you with the same intelligence, dedication, and industry that you have displayed with us over these last 4 years. Today, you must decide to become a physician, be a leader, be involved in the changes that will be defined and implemented over the next 4 years. If you become a leader in our profession, you will be involved in these committees, the corporations, and the consultations that lead to changes in your community healthcare delivery. Is this success possible? Absolutely. Truth today is that you can and will be a success. The truth is that if you work hard, if you dedicate to your patients, immerse yourself in your profession, and keep pace with advances that you will each see every year, you will definitely succeed. And your success will be reflected in your personal life. During each commencement at which I have had the honor to speak, my final charge to each graduate is to become active and involved in your community. Winston Churchill once said, "We make a living by what we get. We make a life by what we give." Success takes place on many levels. One level is material, one level is professional. However, by far, the most important level of success is personal. You will experience personal success in direct proportion to the amount of time and attention that you give to your family and to your community. Become involved, get involved with your community, your hospital, your children's schools, or your places of worship. The effort that you make is a seed that returns incredible fruit. Children who know their parents, friends who admire their peers, and community leaders who trust the medical professionals. This involvement will ensure that your success and you will have a fulfilling life. You leave us today, but we do not want to be the last time that we see you. We need you to maintain a strong tie with us. We need you to proudly carry the diploma that you take from this stage. We need you to become a permanent member of the TUSPM family. For from today, you will always be associated with our name, Temple. And our name will always be associated with yours. Go forward today and dedicate yourself to not only being the best podiatric physician that you can be, but being the best person that you can be. In that way, your development will always be proudly claimed by you, by your family, and by us here at Temple University. Congratulations, class of 2011, and please come back and see us often.
Thank you, Dean Mariachi. Provost Engler, Dr. Schoenhaus, Dr. Mann, honored guests, Temple University trustees, Mr. Ronald Donatucci, Mr. Patrick Eiding, Mr. Michael Williams, Dr. Novicki, Chairman of the Board of Visitors, members of the Board of Visitors, deans, faculty, family members, graduates, honored faculty, administrative personnel from TUSPM, guests and graduates. Greetings. Arguably, I have now fulfilled my assignment as displayed in your program, but you're not going to get off that easy. That would be too easy. Greetings to the TUSPM graduate class of 2011. My name is Michael Davis. I'm Executive Director of the Pennsylvania Podiatric Medical Association, and I speak here today at the invitation of your Dean, and I wish to thank you and the Dean for that privilege. I'm also the father of 3 sons, and each of whom has given me the opportunity